Good afternoon. My name is Susanna Gurr, and on behalf of the team here at the BC Centre for Employment Excellence, I would like to welcome you to our webinar today. Before we begin, we're going to take a moment to answer a poll on your screen. If you are participating with a colleague or in a group, please select the most appropriate or common answer. We will show you the poll and we'll close it in a few minutes and let you know the results in a few minutes. For those of you who are unfamiliar with the BC Centre for Employment Excellence, it was created in 2012 with funding from the provincial and federal governments to serve as a research and knowledge sharing organization for BC employment service providers and employers. Our mandate is not only to conduct innovative research, but also to find ways to share that knowledge and best practices with you and BC practitioners and employers. We created this webinar series as a way to reach out and connect with practitioners. Through this series, we have highlighted research by the Centre, but are also tapping into the knowledge and expertise within the employment services community. You are invited to view the video recordings of previous webinars that we have posted on our website. Today, we're delighted to welcome Dr. Paul Malette of CBI Consultants. Since 1990, Paul has been a director of CBI. He has more than 25 years of experience working with children and adults with complex support needs. Paul and his colleagues co-authored a paper describing the lifestyle development process that was published in the Journal of the Association for Persons with Severe Handicaps. Dr. Malette continues to focus his research and training on positive, person-centered supports designed to improve the quality of life for the focused person and their families. In 2008, CBI Consultants was one of the 8 service delivery agencies that participated in a 4-year customized employment demonstration project, a collaborative project between Community Living BC and the Ministry of Social Development and Social Innovation. The service providers delivered customized employment services to individuals with developmental disabilities. During the project, providers found 242 employment placements to assist 182 individuals to attach and remain attached to the workforce. We are pleased that Paul is here today to share results and lessons learned from the demonstration. It's just one second. I'm looking for our results on the poll so I can share that with you. And from our poll, many of you, there's 21% have applied all aspects of the customized employment approach, 33% some parts, 8% have taken some training but have never delivered customized employment, and about a third of you are new to this approach. So before I hand it over to Paul, a few housekeeping items. The presentation will last about 45 minutes, and due to the high number of participants, we will be muting the audience throughout the presentation to ensure the quality of the audio. We encourage you to use the questions feature on your dashboards to submit any comments and questions. My colleague Greg will be compiling the questions for Paul, who will be responding to them at the end of his presentation. We are recording the webinar and will post a video on our website along with a link to the presentation slides. With the high number of participants today, we may not be able to address everyone's questions during the webinar. However, there will be a blog and it will be a great place for you to continue to engage with Paul and other practitioners. If you lose your internet connection during the presentation, please reconnect using the link emailed to you. If you lose your phone connection, redial the phone number, which appears under the Information tab, and rejoin. Now it's my pleasure to hand it over to Paul.
Thank you, Susanna. We're just getting the slides up. Welcome, everyone. And here we go. So let's first take a look at our agenda and our outline. So I'll give us a brief introduction to customized inclusive employment. And then we'll go through an overview of evidence-based practices. And then I'll introduce CBI Consultants and how we became involved with the demonstration project. And we'll share with you the learning through that demonstration project. So we have a fair bit of information to cover, but I'm sure we'll do it in 45 minutes. Okay, here's our definition of customized employment. So customized employment is a flexible process designed to personalize the employment relationship between a job candidate and an employer in a way that meets the needs of both. So what we're looking at here is a mutually beneficial relationship. And that relationship is based on an individualized match and negotiation between the strengths, conditions, and interests of a job candidate and the specific business needs of an employer. So this is a really key feature of customized employment. We're really focusing in on the individualized strengths of the focus person and then seeking a mutually beneficial match with an employer. Let's now look at some of this definition in a little more detail. So customized employment seeks to negotiate the essential responsibilities of a job as defined by an employer and or the non-essential expectations of a job for purposes of customizing a unique job description for the job seeker. We're going to see a video shortly, and I'll go through that point after we see the video. Customized employment occurs in integrated community workplaces or self-owned businesses. So they're not occurring in segregated facilities. This is another important distinction. Customized employment also involves pay at or above the minimum wage. So it's not subsidized wages, it's not different wages than other individuals in the inclusive workplace. Customized employment results in an employment relationship between the individual and a community employer. One person, one job, without an intermediary holding the employment relationship. Customized employment is driven primarily by an exploratory process such as discovery, as opposed to a comparative assessment or evaluation. We're going to go into detail on all of these points. And customized employment provides access to ongoing employment supports as needed. Let's now take a look at our video that illustrates customized employment.
My name is Malette, and I am working at the Home Depot, and I work very hard, and that's brilliant.
Why do you like working at Home Depot, and what do you like most about your job?
To work with our people, work with our people, with helping the houses. Oh, I always do the bar.
How does it make you feel that you have a real job?
I do so better. I like my life.
So Jeremiah is a really good example of what we were talking about in terms of the definitions of customized employment. So here's Jeremiah. He has various strengths. He's a really hard worker, loves helping people, and he also loved shiny things, particularly barbecues, working with his hands. And with that strength in hand, we were able to go and identify with those themes and strengths, well, where were some particular job matches that in the community? So obviously Home Depot was one of the potential employers. You'll note as well that Jeremiah's job is not a traditional job description. So there was not a job posting at Home Depot that had someone specifically working with barbecues and doing some of the other work elements. So what we had to do was create an entirely new and negotiated work, a job for Jeremiah. Home Depot was very open to that. It was an unmet need for sure. What it did allow was some of the other customer service employees at Home Depot to focus in on other aspects, and the barbecues were definitely not being cleaned, not looking in their greatest, in great shape when people were entering the store. So there's a really good example of Jeremiah negotiating a job that did not exist at the regular wages that the other employees were receiving, and he was a fully included member of Home Depot, participating in all of their after-work functions as well. So let's now take a look at the research. So what do we know from the research? When we look at our Canadian American studies, individuals with disabilities are chronically unemployed or never employed. So the range is 65 to 90% unemployment rates. And when we specifically look at individuals with developmental disabilities and autism, they have the lowest employment rates. And individuals with autism actually having the highest unemployment rates of that group, in the 90% unemployed range. However, when we look at randomized clinical trials, we have shown that the customized supported employment can dramatically alter these numbers. We also know from the research that inclusive employment was one of the most effective therapeutic interventions in mental health. And here in BC, part of Community Living BC's most recent research on quality of life with Dr. Robert Shalak, we see that inclusive employment, real work for real pay, correlates with improved quality of life in all domains. So the question is then, why this great disconnect? If our research shows us that customized and supportive inclusive employment can alter these unemployment rates dramatically, why is it that we still have these chronically low employment rates? This is the reason. Let's take a look. Let's review our traditional support system. So for the past 40 years, a continuum of handicap supports has been in place for people with disabilities upon graduation from high school. This continuum of supports goes under various names such as the Handicap Continuum, the Readiness Model, and the Least Restrictive Environment, or the LRE. Here are the assumptions of the Least Restrictive Environment model. So the notion was that people with disabilities can be placed upon this continuum of supports. And the reason it's called the Least Restrictive Environment is at one end of the continuum, you'll note with where we're seeing institutions, that's the most restrictive end. And the least restrictive end in the residential continuum is called independent living. So based on the level of disability, people are placed on the continuum. So the more severe your disability, the more restrictive the placement, your residential placement. And there's a matriculation assumption. So the assumption from the 1970s and 40 years ago is that the more severe your disability, the more restrictive and specialized your placement. So you would start, say, in an institution, and you would go through an intensive training program, graduate to a long-term care facility. So note the matriculation assumption here. You're supposed to move through the continuum. And then as I learn more skills, I graduate to a less restrictive environment, such as a group home, learn more skills. I might graduate to a supervised home, learn more skills, then I get in semi-supervised home, and finally a home of my own. Now let's look at the vocational continuum. The same logic model, same assumptions. So based on my level of handicap and disability, I would be placed on this vocational continuum. So the more handicap, the more severe my disability, the more restrictive my placement. So the assumption or thinking was that I would start in the day activity center, learn skills, get ready, graduate to a community day program. As I learn more skills there, I graduate to sheltered work, learn more skills in the sheltered environment, graduate to a work crew, learn more skills, graduate to supported or subsidized work, and then finally, as I learn skills in that environment, I finally graduate to inclusive employment. Let's look at decisions made in the continuum model. So a deficit profile approach was taken. The continuum of services or readiness model depends on a deficit profile to make decisions about where the person should enter the continuum. So for the past 40 years, what's been happening with people with various levels of disabilities, particularly those with the most significant disabilities, a profile would be done typically with standardized assessments and tests noting what skills they could not do or what they could not perform. Based on that deficit profile, they'd be placed on this continuum, and again, individuals with more significant developmental disabilities typically placed in the most restrictive settings, such as the day activity centers, community day programs, with the assumption that we'll teach them specialized skills and over time they'd graduate to inclusive employment. Well, 40 years of research tells us that the matriculation assumption is false. Individuals do not matriculate through this continuum, and they tend to get stuck in the continuum, never graduating from sheltered, volunteered work or day programs to inclusive employment. That's specifically why we have such chronic high unemployment rates for this population. So now let's look at the research on supported employment and really that revolution beginning in the late 1980s. So by the late 1980s, we had research already, probably had about 20 years of research noting that the matriculation assumption was proving false. So support employment really revolutionized the thinking. So here's the notion of we'll place individuals in inclusive employment and train and support them through job coaching to be successful. So this is place and train versus train on the continuum, get ready, matriculate to inclusive employment. Here is another real important feature in that revolution. We see now a zero exclusion principle. So from the late 1980s, the notion was everyone with the right support is able to achieve inclusive employment. So we're not screening anyone out as unemployable or as employable, screening people out as employable based on deficit profiles. Let's now look at the British Columbia context here, which brings us to this, to our various employment first initiatives in British Columbia. So based on that disconnect of what the research tells us can be and what is actually existing in terms of employment rates for people with disabilities, we have a number of initiatives. We have an employment first initiative, we have community action employment plans, we have our one government approach, our one door policy, a focus on transitioning youth, and a focus on transforming our day services. So what we have in British Columbia is a number of our government agencies, Community Living British Columbia and Work BC, Services to Adults with Developmental Disabilities, Ministry of Education, Ministry of Children and Family Development, and Ministry of Social Development really coming together to look at how do we change this trajectory and how do we increase employment for people with disabilities with an employment first focus. So here's our introduction to CBI Consultants and how we became involved in this process. So it began 5 years ago with a small innovation grant from Community Living British Columbia. It really started with just 5 clients. We were mentored by Dr. Paul Wayman from Virginia Commonwealth University. When you saw that previous slide about the revolution in thinking and practice, Dr. Wayman was one of the pioneers of that revolution. And Dr. Wayman's also voted one of the top 100 special educators of the millennium, so a real leader in this field. Following the innovation grant, we received 4 other customized employment contracts with Community Living British Columbia and the Ministry of Social Development. And to date, we've placed more than 140 individuals in inclusive paid job placements. I'll give you a little bit more detail about CBI Consultants. We're a training and technical assistance center, and we've been working with individuals with complex support needs, as Susanna pointed out, for the past 25 years. So we're supporting government agencies, community agencies, schools, families, providing training and technical assistance on positive behavior support, high school transitions, self-determination, customized employment, and what we call peer power social inclusion process. Here's our overarching process that was alluded to earlier on. Our entire training and support model is based on the lifestyle development process, which we published in 1992. And I'll just go through each piece of the lifestyle development process. So the lifestyle development process begins with that strength-based personal profile. We're looking at developing fully inclusive lives in all life domains. So where will I live? Where will I work? My inclusive social relationships. Where will I spend my rec leisure time in the community, going to college, and community access. So we're really looking at a whole life planning process, but for the purposes of our webinar, we're going to focus on the employment, customized employment. So once we have that inclusive life established, then through the lifestyle development process, we start applying what we call the support strategies or evidence-based technical supports in terms of augmentative alternative communication skills, positive behavior support, social inclusion processes, and task-analyzed systematic instructional practices, which I'll allude to a little further on in the presentation. It's a real key component of customized employment. And through the entire lifestyle development process, our desired outcomes are improving the person's quality of life. So let's look at how the LDP was used and integrated with customized employment practices and the mentorship from Dr. Wayman at VCU. So just once again as a summary, here are the components of our Training and Technical Assistance Center. We take research-based best practices, we demonstrate in the community, refine those practices, and then move into training and mentoring others to implement these procedures. We turn to Dr. Wayman in the initial innovation grant with CLBC to add the customized evidence-based employment practices to the LDP. So through that mentorship with Dr. Wayman, we were really able to establish what are the core inclusive customized employment practices that represent best practices. So this umbrella can be viewed as our current knowledge of those best employment practices and principles. So inclusive customized employment is a really large umbrella that incorporates customer choice, strength-based perspective, workplace integration and inclusion. There you see those competitive wages, individualized workplace supports. You see the strength-based person-centered planning. Here's our supported employment practices as well. Job negotiation, assistive technology, accommodations, resource ownership, micro-enterprises, and self-employment. Let's now look at the process that we developed in conjunction with Dr. Wayman. So here is your customized employment process. So here we see discovery as the first step. This is that exploratory process. The strength-based process that involves identifying a personal profile of the individual's strengths. And again, this is often called authentic assessment. So we're out with the individuals, observing them in the community, observing them in various activities that they're very good at. And the outcome of the discovery process is to identify their ideal conditions of employment, have a representational portfolio of their strengths and abilities and a DVD, and potential employment themes that we use to drive the next part of the customized employment process, which is job development. So note here that we begin with the strengths of the individual and their ideal conditions of employment. So more of a supply side perspective than demand side. And now we go searching in the community for potential employers that would be seeking that skill set. So through that process now of job development and job customizing, we find an appropriate placement. It's a mutually beneficial relationship between the individual strengths and employer. And then we move into what many of you will recognize as more traditional job coaching. So this is our systematic instructional piece now. You'll see applied behavior analysis coming in here, where we have our natural supports in place. The job is to the satisfaction of the employer, and we now fade supports to the natural support. So in the job coaching, we are now fading completely from the work site. Person's under the natural supports. They now have an inclusive paid job. It's based on their strengths and preferences, and it's a mutually beneficial relationship between the person and employer. Let's look at a little more detail. We'll go through the first step, discovery, and that process of identifying the ideal conditions of employment. So here in discovery, putting the person-centered puzzle together. So the goal of strength-based discovery and person-centered planning is to identify the key or ideal conditions for successful employment. So you're funneling the key information down to come up with ICE. So we're looking at what environments does the person succeed in? What people and social interactions do they prefer and do well in? We look at, it doesn't necessarily need to even be employment. We take a look at what activities do they excel in, and we extract from that observation particular skills that could transfer to employment. We look at their hopes and dreams. We look at the particular skill set and how they learn best, and then we funnel that down to what we call the ideal conditions of employment. Now, with the ideal conditions of employment, we now go, we look at job exploration and customization. So with the ideal conditions of employment in hand, we now start examining particular job placements. So when exploring and developing jobs, it is often the case that a traditional job or job posting will not be the right fit for your focus person and employer. This is a really critical point. It's just the whole, this is how customized employment involved. Many individuals with fairly complex support needs were deemed unemployable because they did not fit into competitive job descriptions. So here we're really looking at creating jobs based on unmet needs, or a traditional job posting that did not exist. Just think back to Jeremiah. That was a job that was completely created, that was a mutually beneficial job based on his strengths and skills and the needs of Home Depot. So with the ideal conditions of employment in hand, what we want to do is we really need keen observation skills. Get in the door and understand what the work environment is all about. So we're really getting in the door and exploring some of those unmet needs and really getting to know a particular business. And here we're looking for potential jobs that do not exist that are a good fit for the focus person and the employer. Once that customized job is negotiated. Now we're into our job coaching and systematic construction. So now that you're in the door and on the job, you'll need to have a clear plan and pathway. So we're starting with instruction. You begin to fade your support, transfer that support to the natural supports on the job site, and then monitor and problem solve as needed with the employer and the focus person. So let's take a look at the outcomes following the mentorship with Dr. Wayman and our demonstration projects with Community Living British Columbia and the Ministry of Social Development. So clients served was 123 and number of placements was 153. The reason we say we have 153 placements is that of that 123, some of those are their second jobs. So percentage of individuals, so this was zero exclusion. No one was excluded from our customized employment demonstration project. So we were able to achieve 85% of individuals that came to us received inclusive real work for real pay. And here were the placement ranges. So there's a whole range of placements. So we have about 30% were in retail. We had about 18% were in manufacturing and construction. We had individuals in food service. We were in office admin, labor, human services, sales, service, IT. We had individuals who were self-employed with their own jewelry businesses, and we had individuals in delivery. So really cutting across broad spectrum of jobs. Range of hours was 4 to 40 hours per week, and the salary range was $10.25 to $18 an hour. So lessons learned from just applying the traditional customized employment process, we saw that dramatic reversal employment numbers from 10 to 15% employed to 85%. So matching the research. We absolutely saw the link to Dr. Sherlock's quality of life indicators. It was almost universally transformative to watch the individuals' lives change so dramatically when they had paid inclusive work. We also saw that clear business case and benefit to employers. Employer after employer continued to tell us what a mutually beneficial relationship it was and how it had, in fact, improved how they even worked as teams. Now, there's a caveat here at the bottom, though. What we did discover that the individuals were almost exclusively dependent on the skill set of the employment specialist to reach those desired outcomes. So we increasingly had more and more people on the wait list, up to 200 people on the wait list for customized employment services. And the people on the wait list were phoning us to see if we had their jobs yet. And some of the other individuals, after we got them their first job, they were unable to find a second job. So they asked us through the customized employment process to get them a second job. So that led us to the second part of learning in the demonstration project was self-determination research. So that led us to the research of Michael Waymeyer out of the University of Kansas. And Michael Waymeyer really doing the bulk of the research on self-determination. So self-determined behavior refers to volitional actions that enable one to act as the primary causal agent in one's life and to maintain or improve one's quality of life. So here's what the research says about the benefits of acquiring self-determination skills. Self-determination skills enhance quality of life, enhance confidence and self-esteem, increase goal-oriented behavior, is essential for positive transitions and outcomes, especially after students leave the school system, increases the likelihood of being successful in post-secondary settings, decreases problem behavior, and increases participation in appropriate adaptive tasks. I don't have this on the slide, but the second part of this is that when we're looking at individuals with complex support needs and disabilities, particularly individuals with developmental disabilities, they will not pick up self-determination skills unless they are explicitly taught. So based on that, on our experiences, with the high employment outcomes, but the fact that we had so many people asking us if we had their job yet, we developed a self-determination curriculum with employment with an employment focus and employment first thinking. So there are 2 levels to the curriculum. The first level is a development of self-directed life plan. So they're identifying their strengths and their ideal conditions of employment, but they're also looking at all of their life's domains. Not only where would they like to work, but where would they like to live, where would they like to spend their time, their leisure time. And then on level 2, here's where we really brought in the full engagement of the focused person on their employment goals. So we now have the individuals fully engaged in the customized employment process. So they're learning to do their own discovery with us. So we're now moving into a coaching aspect. So the individuals in groups, so we called this the job club. So rather than people sitting at home asking us, do you have our job yet? We said, you're going to come in with a group of other individuals and we're going to start job club. So we started teaching individuals how to do their own discovery process, how to identify their own ideal conditions of employment, and how to start moving through, okay, with your own ideal conditions of employment, where would we now need to look for different jobs based on those themes? So we're still moving them. We're still working very closely with them, but now they're fully engaged in the process. So we'll call that self-directed employment through self-determination in the job club. And what we were able to find that we had 32 participants. We'll call this phase 2 of the demonstration project. And we had 37 placements. Again, some of those individuals, that would be their second job. What we found is that we can still keep those high long-term inclusive employment goals. So 78% of the folks participating in the job club received inclusive employment. The only reason it's lower than the 85% is that some individuals are still in the job development phase. So we saw there was no real drop in those high employment rates by doing it via the self-determination and self-directed employment. We definitely saw the increases in self-esteem, confidence, increased social skills, relationship skills, self-advocacy skills, individuals being able to identify their own learning style, able to identify their ideal conditions of employment, able to articulate their strengths and challenges, and most importantly, able to speak and advocate about these to others, including employers. So really transformation in, and this was reported by people that, like family members saying, what a change was occurring. So through those first 2 parts of the demonstration phase, we really got a full understanding of that employment skill set. So what I'm going to do here is kind of guide us through the diagram. So in the middle is our employment specialist. So on the left-hand corner, bottom left, you'll see through that employment specialist-driven process, when we were delivering the discovery, job development, and job coaching and monitoring with high fidelity, we were able to get 143 people, inclusive job placements. We were also able to identify that we can train and mentor others to do that. So that was the customized employment level 1 and 2. And we also discovered that skill set is necessary. You need to be able to go out and really have a good handle on discovery, job development, and job coaching in order to shift over and do that, to guide people through the self-directed and self-determined employment process. So here in the self-determined employment process, where the individual is fully engaged in that process, you'll see that we're teaching them how to identify their ideal conditions of employment. We're teaching them how to go about the job development phase. And here the employment specialist, you'll see those two orange lines. Your employment specialist role really comes in at those job development phases and job coaching phase. So we really learned a lot through that process. What that skill set is, how we need to teach that, and how that can be incorporated through a self-directed and self-determined employment process. That led us to the last part of the demonstration project. With our partners, CLBC and Services to Adults with Developmental Disabilities in Ministry of Social Development, we realized as well that we really needed to be doing some of our training and mentorship with our high school partners. Because when we look at our current system, this isn't just British Columbia. This is very representative of what we know is happening throughout North America. In terms of our inclusion process, when we started our preschool kindergarten years, we see students are typically physically included in their kindergarten programs and preschool programs. On the social side, we see that they're seldom invited to play dates and birthdays. We see increasing socialization, often exacerbated by one-to-one teaching assistance. We see increasing socialization. We see a lack of social inclusion in our high school years. And typically, students are not graduating with paid inclusive employment on their resumes. With no paid work, what tends to happen is we see that they're graduating without that paid work experience, without those inclusive social networks, and few, if any, natural supports in the community. They're ending up or expecting to receive residential service and day programs for the rest of their lives at extremely high cost. So I'm cognizant of the time here, so we're just kind of wrapping up. So when we look at the evidence base and predictors of successful high school transitions, here's what we find. That paid real work for real pay in high school is one of the biggest predictors that students are going to lead an inclusive life post-high school and not end up in that least restrictive environment or handicapped continuum. Here's another big predictor, parental involvement. Families advocating for employment and inclusion in the high school years and active in that process. Another predictor of successful high school transitions is self-determination instruction in high school, as well as general education inclusion and instruction in life skills and life goals. So the last 2 years of our demonstration project, we started doing the self-determination instruction and employment with our high school partners. So we have high school partners in North Vancouver, in Surrey School District, 5 schools and 50 students. In Burnaby, we're doing research with UBC on this process. We're in Vancouver. We're doing one Planning 10 class with 26 typical students. And we're doing 6 other VSB schools. We're working with the Catholic School Board, starting with 1 school, and we're recently just beginning with the Yukon School Board. So again, in this diagram, what we found is we can teach teaching assistants to actually learn those employment specialist skills in terms of discovery, job development, job coaching. And with those skills in hand, we can now have a teacher-driven process where students are actively involved in developing their own self-directed life plans and employment goals, and teaching assistants can provide the employment specialist role and training. So what we found it's really been quite exciting in this learning process and the demonstration project, that where we are now in 2014 is we have never seen in 25 years an initiative that has gained such interest in the school system from both regular and special educators. So where this project is potentially heading is really from a universal design perspective, where the self-determination and a focus on employment and all of my life goals could potentially replace Planning 10. So now we have, it's not just a disability-related initiative, it's an initiative with all students, which opens up possibilities to have these great mentorships where all students are now, after doing their self-directed life plans and employment goals, they can be connected to mentors in the community, opens up all these opportunities for inclusion in terms of peers helping peers. So that's a summary of what we've learned through the demonstration projects, and I think through that process as well, this is another big piece of the research, is now converting from 1972 in this least restrictive environment or continuum-based thinking to a community-based approach and full inclusion in all life domains. And what we do know from the research and our demonstration pilots, that if we can get paid inclusive employment, then it opens up all those other doors to an inclusive life in all domains. And lastly, through that process, we've now, through that demonstration project in our Training and Technical Assistance Center, now developed the self-determination curriculum, level 1 and 2, customized employment training, level 1 and 2, and that's online training and direct training, as well as direct coaching and mentoring and support, as well as our training on positive behavior support.
Okay, thank you very much, Paul. You can see here the contact information for CBI Consultants if you'd like to learn more information. And on this next slide here, we've just listed some customized employment resources and training opportunities. So this is just a selection of some of the other resources that you have to learn more about customized employment. And please, if you're aware of other additional resources, let us know. So make other folks aware and us aware of any other additional resources that you know of on the blog post that's going to be attached to this webinar. There were a few questions that came in while Paul was presenting, so I'm going to just take a minute to look at some of these questions that were posed, and in the meantime, please feel free to continue to submit questions. We've still got about 7 or 8 minutes, so if you have any questions for Paul, please fire away. Go to the questions box in your panel and enter those questions. So the first question that we have is, Paul, are you aware of the unemployment rate of individuals with cognitive impairments in BC specifically?
Yeah, I don't know that we have an exact number, but I think it's probably pretty safe to say that we're probably in the 80% unemployment rate.
I think it's presented on the PALS data, and it is very low. Right.
Okay. And another question is, what were the steps in the ICE funnel? So going back to the ICE diagram, I'm not sure if we can get that slide back. I think we'll just leave it for now, but someone's asking about the steps in the ICE
Okay, so
funnel.
First, beginning with personal profile of the individual's strengths. So on that ICE funnel, so we use our own personal profile that asks the individual and their support network to identify their environmental preferences, activity preferences, people preferences, learning style, favorite movies. We even asked their favorite foods. So We first use that profile of their strengths, and then we look at different activities that they really prefer, and then we go and observe the individuals in various activities to really tease out what their strengths and skill set is. So it doesn't even necessarily need to be an observation in employment. We simply go, if they really love movies or going to the movies, we'll go actually to the movie theater to see what it is about movies that they enjoy, or some of the things that they're really good at. We'll watch them engaged in the activities that they're really good at, and we'll extract what that skill set is. And that helps us then identify the ideal conditions for employment, which environments will they thrive in, what types of personal characteristics, social characteristics of the workplace.
Okay, and a really great question here on someone's asking the difference between customized and supported employment.
Okay, excellent. Excellent question. Really, I was trying to get at that with that, the umbrella slide. Really, when we were working in the mentorship with Dr. Paul Wayman, that's why he kind of gave us that slide. It says, think about customized and supported employment as this big umbrella of all of those practices. In terms of customized employment, if we were really going to follow the true definition of customized employment, customized employment is probably the most intensive piece of supported employment, where you actually have to go in and create a job that did not exist. So really, customized and supported employment really come under a bigger umbrella of inclusive employment. But if we're really going to follow the true definition of customized employment, it would be a job that did not exist, whereas in supported employment, that's not necessarily the case. But we're all following strength-based inclusive practices on that big, broad umbrella.
Okay. And you provided the figure for the employment rate from the demonstration project earlier. I believe it was about 85%. Out of that figure, do you have an idea of how many are still employed?
The majority would still be employed, so.
Right. So majority would still be employed. So we're actually involved with them in terms of monitoring.
Okay, so the majority, more than 50%. Okay.
Yeah.
70 to 75%. Okay. Another question here about services in rural communities. What about services in rural communities with limited employment opportunities and the issue of potentially, quote unquote, burning out employers by shifting supports to the employer? Maybe just, do you have a general comment about maybe the differences when you're working with rural communities?
Yeah, I think that's the beauty of the customized or supported employment. When we do that with high fidelity, remember you're finding that mutually beneficial relationship. So by definition, if we're doing that well, we're not burning out an employer because we create this great fit. And although there might be some challenges in more rural communities in terms of opportunity and volume of jobs, there's a skill set of individuals in communities, and there are places and those mutually beneficial relationships that exist. So we shouldn't be burning out employers. If we're burning out employers, then we're not doing our supported customized employment with high fidelity and a good match.
Okay. And a question about the PBS curriculum. Is that available so for workshops? Can that be purchased? And how do folks go about doing that?
Absolutely. We have our positive behavior support online training, so you can get in touch with us through info@cbiconsultants.com.
Okay. And a question just about the webinar itself, if it will be posted and uploaded, and it will be later this afternoon, and everyone should receive a follow-up email tomorrow morning to provide the link and access the taped version of the webinar.
Paul, we really appreciate your time, and thank you so much for your presentation today. And as you can see from the poll we did earlier, you've introduced customized employment to many of the participants. And also thanks to all of you for attending the webinar today too. As Greg mentioned, the session was recorded, and we will post a video of the presentation on our website. You will be receiving an email shortly with a link to the presentation and video. We have found, though, that the system does not record those of you who have connected only by phone as having attended. So you may receive an email saying that we're sorry that you were unable to attend. If that's the case and you need a confirmation of your attendance, please contact us at the address in the email. And as always, we welcome your input and feedback. We would also appreciate any suggestions you have for future webinar topics. A few quick announcements before we end today's session. Coming up very quickly, the BCCDA 17th Annual Career Development Conference that we are partnering with BCCDA is less than 2 weeks away. There are still spaces available for the event, and it's taking place March 7th and 8th in Richmond, BC. So afterwards, if you haven't registered yet and you're thinking of registering, please head over to the BCCDA website. We are taking a break in March from the webinar, but in April, the Center will be welcoming Gastown Vocational Services to present a 3-part free webinar series on working with people with mental health issues from an employment lens. The 3 webinars will take place April 2nd, 16th, and 30th. And I think we'll be opening registration for the April 2nd session within a day or two. When you exit the webinar today, you will be asked to complete a short survey. This is the first time we've done it. It should only take you about a minute, and your feedback is very valuable for us and to help us with future planning for future webinars. Again, if you participated in this webinar with a colleague or in a group, please select the most appropriate or common answers. Thank you very much for your help on the survey. And that ends our webinar for today. And on behalf of the BC Centre for Employment Excellence, thank you very much and have a great afternoon.